everyone. I'm super late. I want to apologize for not being in the conversation sooner. I somehow managed to space this part. It's been a rough week. Anyhow, I wanted to go over the questions. How do human rights principles relate to different interventions used in social work practice? And why is it important to analyze power structures when applying human rights to particular situations? So I'll start with the first one. How do human rights principles relate to different interventions used in social work practice? When we take a look at human rights principles, we need to remember that they're not just abstract ideas, right? They are practical guides to support social work interventions at all levels, at the micro, meso, and macro levels. At a micro level, it's important to remember that the interventions there are really based on autonomy, privacy, and self-determination, really upholding what we know to be not only human rights interventions, but also really a part of our social work code of ethics, right? That self-determination piece. And upholding civil and political rights. We also want to create a safe space for folks where the environment is trauma-informed, where the work that we are doing with them is based off the dignity and worth of a person, as well as empowering them to meet their own needs by taking active steps to work on skill building. At a meso level, that's community-based interventions, we really want to support and promote social inclusion. We really want to think about which economic or social supports are needed, as well as really thinking about cultural needs. What cultural needs do our clients need more support around? Let's see. At a meso level, we would be supporting them with finding access to housing or healthcare, education. And at a macro level, we're going to be working on prioritizing social justice through equity and working on policy changes. What can we do to change laws? We have a lot of laws and policies, practices, and procedures that only further harm people with marginalized identities, specifically people of color and our LGBTQIA plus community. We really need to be thinking about shifting the perspective from this charity needs-based model to the rights-based models. If we are practicing every day when we're working with a client and remembering in the back of our minds, like all humans deserve housing, equitable health care, rights to their bodies, equitable services. If we're working with somebody who needs appropriate ADA accommodations, we're going to make that happen because they deserve equitable healthcare related supports. So why is it important to analyze power structures when applying human rights to a particular situation? Because there's always a power dynamic that is created or sustained an inequity in the system that's harming people. And these power imbalances decide who has access to resources, whose voices are heard, and whose rights are denied. For example, infringing on a woman's right to autonomy by restricting access to abortions and contraception. That leads to socioeconomic oppression by creating barriers to education, employment, and financial stability, which means that we'll never get ahead. Not like this. So that's my thoughts. I will talk to you guys soon. Sorry for the lateness.